Primary lung cancer is a disease that the normal cells in the lung, they change and become malignant cells that start growing out of proportion, and after that can invade or can travel to other parts of the body. Why is the lung cancer happen? Could be mostly for a toxic exposures like the smoking, that is the major cause of lung cancer in this country, or could be for a genetic predisposition. The other thing is that people don't realize, but there are a lot of people who doesn't smoke and still they can get lung cancer. Why? One is because the secondhand smoking. They have been living with somebody who smoked all their lives and they live with them and they smoke next to them. And there are other minor reasons that could be because of genetic causes. The first thing that we do is try to prove that this is cancer. How we do that? There are different methods. One is to do a bronchoscopy. In this hospital, we have an advanced technique that is called the navigational bronchoscopy, that with the help of the CT scan at the bronchoscopy, we can put the bronchoscope to the mouth and the CT scan guide us to find exactly where the nodule is. Usually this procedure is performed by the pulmonologist. After we have the diagnosis of the lung cancer, we have to find out what is the staging of the lung cancer. That is what is going to give us the guidelines to pursue the treatment. From stage 1 to stage 3, there is an option for cure. That is so important, that is always something that we can do to try to cure the cancer. Early lung cancer, usually stage 1 to 2B, can be treated initially with surgery. No, all the time surgery is the first option. Sometimes you have to go for chemotherapy or something else. But for sure, in the early stages, surgery is the best option. We have minimal invasive options. One that is called a thoracoscopic procedure, that if you do small incisions that is less than 1 centimeter in size, 2 or 3 incisions, and you put a camera in one of the incisions and a system port instruments in the other incisions, and you proceed to remove the cancer. The standard surgery for lung cancer at this time is lobectomy, because you want to have a margin of when you resect this cancer, this nodule, in the way the cancer doesn't come back. There are also another procedure that you do a less resection of the lung only if the patient doesn't have the lung capacity to tolerate a major surgery. Before we offer an operation to any patient with lung cancer, we're gonna do one very important test that is called pulmonary function test. That is gonna measure the capacity of the lung. Early detection is so important because you don't have symptoms. And sometimes when you have symptoms, can be too late. And the earliest you catch any cancer, not just in lung cancer, it's like a breast cancer, like they do the mammographies, your option for cure is higher. And we want to catch it early in the way we can help you and cure you.